This is the Nutrition During Lactation module, part 3. We had just finished talking about vitamins, and now we will move on to minerals. So we have talked about calcium before, and you can see that the needs are much higher in the younger ladies. 14 to 18 years of age, the requirements across the board, whether they're non-pregnant, pregnant, or lactating, are up at 1,300 milligrams a day. 19 to 50, 1,000 milligrams across the day. Keep in mind that calcium is mobilized from the maternal skeleton during breastfeeding. Certain prenatal supplements that women may continue taking after they give birth, or even other supplements, may not have adequate calcium to supply that mobilization. Now, even though calcium is moved from the maternal skeleton into breast milk for the baby, there is significant recovery afterwards, and studies are showing that breastfeeding does impart a protective effect against later on osteoporosis. In terms of calcium supplements, one thing to remember is to improve absorption. You do want to take calcium supplements that can be divided into 2 or 3 doses and possibly taken with meals. And vitamin D does facilitate the absorption of calcium. Those two are pretty good partners. And so whenever possible, you want to recommend that a calcium supplement contain either 400 all the way up to 800 international units of vitamin D. Some good calcium supplements to recommend include calcium carbonate, which are found in calcium soft chews, Caltrate, Oscal, Tums, or Viactive, as well as other supplements. And those are pretty readily absorbed by most people, and they also are cost effective as well. Calcium citrate products such as Citracal can also be recommended, but again, those may be more expensive, and sometimes those you need to take more of those in order to achieve the optimal dosage. So those may not be the best frugal choice. Now, in nature, calcium is found in milk and yogurt and cheese. These are the main food sources of calcium for the majority of people in the United States. You can also find calcium in certain vegetables like Chinese cabbage, broccoli, and kale, and these are actually fairly adequate vegetable sources of calcium. Remember that in earlier lectures we talked about how even though spinach does have some calcium, that calcium is pretty poorly absorbed. Fish with soft bones that can be eaten, like canned sardines or canned salmon, are also decent sources of calcium. Breads, pastas, and unfortified cereals, while those are not necessarily rich in calcium, those do contribute significant amount to the American diet just because we consume those foods often and we consume them in large amounts. Calcium is added to some breakfast cereals and fruit juices. It's also added to certain soy and rice beverages, as well as to finding a home in tofu. So to find out whether these foods have calcium, you do need to check the product labels. So just as a side note, inulin, which is a prebiotic, it can also help with calcium absorption. So you have vitamin D and you have inulin. Inulin-rich foods, those include bananas, which again, that's a great snack to take on the road, for a quick breakfast, for a fast lunch, as well as garlic, leeks, onions, and asparagus. Those are all inulin-rich foods, again, which help with calcium absorption. Wheat is also rich in inulin. So again, the diet high in variety is important. Iodine is a vital component of thyroid hormones. The mother's thyroid hormone levels affect proper fetal growth and neurologic development during pregnancy and after birth. So iodine has a role in metabolism, protein synthesis, as well as in enzymatic activity. And it also plays a role in fetal and infant skeletal and central nervous system development. So both the American Thyroid Association, as well as the American Academy of Pediatrics, recommend that all women of childbearing age consume 150 micrograms of iodine daily, either from their diet or a supplement. Now, infants do usually get enough iodine from breast milk, and the recommended dietary allowance, or the RDA, is higher for women when they are pregnant or breastfeeding, just in order to support not only proper fetal growth during pregnancy, but infant growth and neurologic development afterwards. Although breast milk contains iodine, concentrations can vary based on maternal iodine levels. If a pregnant or breastfeeding woman is deficient in iodine, the fetus or infant may be at risk for iodine deficiency and associated cognitive and psychomotor impairments. So as you can see, the pre-pregnancy requirement is 150 micrograms a day. It jumps up during pregnancy to 220 micrograms a day, and in breastfeeding it soars up to 290. Not all multivitamin and prenatal supplements contain 150 micrograms of iodine. All women should check the nutrition label or check with their healthcare provider about whether their multivitamin supplement or prenatal vitamin, in the case of a prenatal woman, contains enough iodine. So who's at risk for iodine deficiency while breastfeeding? Well, there are at-risk populations, and women who don't consume enough dairy products or who smoke cigarettes, women who don't use iodized salt, and women who eat foods containing goitrogens. And those are substances that actually affect how well the thyroid gland makes the thyroid hormones. And these foods can include Brussels sprouts, kale, cabbage, cauliflower, radishes, and broccoli. Content is variable. Similar to selenium, content is variable because soil levels of iodine is variable. Now, seaweed is a decent source, but again, the content is very, very inconsistent. Now, more than 70 countries, including the US and Canada, similar to folacin and similar to vitamin D, have salt iodization programs. Around 70% of households worldwide do use iodized salt. Around 90% of households in North and South America use iodized salt, but less than 50% of households in Europe and the Eastern Mediterranean regions use salt. In the US, salt manufacturers have been adding iodine to table salt since the 1920s, and it is still a voluntary program. Now, one would think that with the American diet and how it's completely, overwhelmed by sodium, one would think that this nutrient wouldn't be that hard to consume. However, the majority of salt intake in the United States actually comes from processed food, and the food manufacturers use non-iodized salt in most cases when processing foods. If they do use iodized salt, they will list salt as iodized in the ingredient list. Iron is one of those nutrients that actually drops. So if you look at the DRI for lactating women compared to pregnant women, you can see that it's almost cut in a third in terms of, well, it is for 19 to 50-year-olds, but it's reduced dramatically from needs during pregnancy to needs during lactation. During lactation, human milk iron levels remain constant because they are pulled from maternal iron stores. They're independent of dietary intake, but because they are pulled from maternal iron stores, that's why it's so important that during pregnancy, women do build up those reserves. For many populations in which the prevalence of anemia is higher than 20%, supplements are recommended at a rate of around 60 milligrams of elemental iron once a week for 3 months, followed by 3 months of supplementation. Then you would repeat that cycle. Full-term healthy babies receive enough iron from their mothers in the 3rd trimester of pregnancy to last for the first 4 months of life. Although the iron delivered through breast milk is in small amounts, as we've mentioned earlier, it's very satisfactory and it's very highly bioavailable. The iron stores of infants are not depleted until they are 4 to 6 months of age or even later. And even still, with that knowledge, the current recommendations from the AAP do recommend supplementation of iron. Now, that supplementation of iron may have a negative effect on breastfed infants. Lactoferrin can lose its ability to inhibit the growth of harmful bacteria when it's saturated with that exogenous supplementary iron. Iron status will naturally improve when infants, in combination with human milk, begin eating iron-rich foods at around 6 months of age. At birth, a healthy infant's hemoglobin level is around 18 to 20 milligrams per deciliter. We've talked about how as the healthy infant's hemoglobin level is high initially and then it begins dropping, but the hemoglobin is also transitioning from a fetal to an adult form, and that adult form is a very efficient transporter of iron. And so even though we see that levels do plunge, the efficiency of transport rises. So current AAP recommendations do include supplementation. For infants who are exclusively breastfed, they consider them to be at increased risk of iron deficiency after 4 months of age. The AAP recommends giving breastfed infants 1 milligram per kilogram a day of a liquid iron supplement until iron-containing solid foods are introduced at about 6 months of age. When solid foods are added to the baby's diet, they recommend to continue breastfeeding until at least 12 months. Now, for babies who are partially breastfed, well, if babies receive more than half of the daily feedings from human milk and the child is not receiving iron-containing complementary food, the iron recommendation remains the same as those for fully breastfed infants. For formula-fed infants, it's recommended that an iron-fortified formula containing around 4 to 12 milligrams of iron be used from birth through the entire first year of life. Premature babies do have fewer iron stores, and so they often need additional iron beyond what they receive from breast milk or formula because, again, most of the iron is transported through the last trimester of pregnancy. Now, looking at vegetarians, the RDA for vegetarians are much higher than for people who eat meat. Now, this is simply because, as we've talked about in other modules, the heme iron from meat is more bioavailable than the non-heme iron from plant-based foods. So therefore, meat, poultry, and seafood do increase the absorption of plant-based or non-heme iron. So animal sources of iron include heme iron, which, like we mentioned in the previous slide, is easily absorbed. You can find heme iron in meat, chicken, fish, pork, turkey, and eggs. And then there's the plant iron, which is non-heme, and that's less easily absorbed. Iron in plant sources come from beans, fortified cereal and bread, spinach, nuts, as well as dried fruits. Vitamin C, lactose, and heme iron all assist in the absorption of iron. Calcium decreases absorption. Moving on to zinc. As you can see from this slide, the RDI for lactating women is higher than those of non-pregnant and pregnant women. The reason for that is that lactation can also deplete maternal zinc stores. And for these reasons, the RDA for zinc is higher for lactating women. Food sources of zinc include meat, some shellfish, oysters, fortified cereals, legumes, nuts, and whole grains. However, bioavailability can be low in vegetarian diets due to the presence of fiber. And that fiber can really bind to zinc and decrease its absorption. Fiber at times can also, and even calcium at times can inhibit zinc absorption. So besides fiber and calcium, high intakes of supplemental iron may also inhibit zinc absorption when both are taken without food. So zinc supplementation may be prudent in any of the following conditions. If a woman has a gastrointestinal disorder that affects absorption, if there's a high intake of supplemental iron, or if cereal and plant-based diets are high in fiber. Chronic high doses of zinc can also interfere with copper absorption and suppress the immune system as well as lower the HDL levels, which are the good cholesterol levels. So the bottom line for a lactating mom's healthy diet. Well, this quote kind of sums it up. Sorry for all the times I dropped crumbs on you while breastfeeding. It's important for moms to take care of themselves so that they can be healthy and be healthy for their children. A mom is asking if supplementation is really necessary. What would you tell her? While eating more food to meet energy needs and the increased absorption of nutrients that occurs during pregnancy are usually enough to meet the needs for most nutrients, that's dependent on when good food choices are made. Vitamin and mineral supplementation can be routine, and supplementation can help cover nutrition gaps. Many women do consume less than the recommended amount of calcium, of magnesium, zinc, vitamin B6, and folate. It is important to emphasize that vitamin and mineral supplements cannot replace a healthy diet. And overall, even if a diet is lacking in certain nutrients, and I realize this isn't on the slide, even if it's lacking in certain nutrients, the perfect milk is still breast milk, even in the face of an inadequate diet. When offering nutrition recommendations to your future clients, I would again suggest to review the dietary guidelines for Americans. And even the campaign at myplate.gov is a great resource for already made meal plans. These meal plans can be tailored to offer specific shifts that are personalized for your clients. And when in doubt, just remember the general rule of keeping half of your plate vegetables and fruits. When you're doing any meal plan, let's go over the slide. Things to consider are planning for breakfast, a snack, a lunch, a snack, and dinner. You want to incorporate in a variety of ways grains, vegetables, fruits, dairy, protein, fats, and oils. Now here are the recommendations for a 2,400 calorie diet. An additional after dinner snack or maybe double sizing one of the snacks during the day can be suggested. Again, the increases in red that you see are just the differences between a 2,200 calorie eating plan and this one. So the grains increase, the protein increases, and even though you're limiting these nutrients, the saturated fat and the added sugars rise a bit as well. Keep in mind that these are maximums and eating less is perfectly fine. The choice to be vegetarian can be due to many, many reasons. There are philosophical values, there's the environment, there's culture, there's economics, and there's health. Meat really only occupied the larger space on our plates for the past few decades. Previously, meat was one of the side dishes, and other elements, other parts of the diet like complex carbohydrates and fruits and vegetables did occupy center stage. Vegetarians that include certain animal products such as milk or eggs can easily obtain all of the nutrients needed for breastfeeding, and the majority of the planet does consume this type of diet. A balanced vegetarian diet is very healthy. It also can provide additional benefits like decreasing excess weight gain due to the fact that you're usually getting fewer calories as well as less fat. A constipation, which can be a common side effect even after pregnancy, can be reduced in this type of a diet just because there's usually extra fiber taken in. Now, the difficulty can arise if a vegetarian woman doesn't really manage her diet well. Now, most vegetarians are completely comfortable and knowledgeable about obtaining a balanced diet. They know where their protein is, they know where their nutrients are, but highly restrictive vegetarians or those following other strict regimens may benefit from an RDN consult and should keep her healthcare provider informed of her decision. Keep in mind some of the nutrients that may be low, and these are listed on the slide. We talked about protein. Protein can be low. Vitamin B12 can be low. Vitamin D may be low, especially if a woman is not consuming vitamin D fortified milk or dairy products. That can be low as well. The same thing with calcium. Women who are vegans may not have enough calcium in their diet as well. Iron is another nutrient that may be low in vegetarian diets. Remember that we said earlier that the American Dietetic Association does recommend supplemental vitamin B12 for vegans, as well as other women who follow a strict diet during pregnancy as well as during lactation. And that's just to ensure that enough vitamin B12 is transferred to the baby. And if women are following strict vegetarian or vegan diets, they do want to check in with their pediatrician and just see if they do recommend a vitamin B12 supplement for their infants or children. So there are a number of considerations when addressing the prenatal or lactating woman's diet. Many of those we've covered to a certain extent during the Nutrition During Pregnancy module, but we'll cover those specifically in how it relates to lactation here. There is cultural avoidance, flavor issues, common food allergens, alcohol, as well as caffeine. So eczema, highly allergenic foods, caffeine, herbs, alcohol, taste preferences, and artificial sweeteners all have an effect on maternal food intake in one way or another, and we'll be discussing those in the coming minutes. So first off, let's look at the foods that a lot of moms will have questions about. Gassy foods. So common culprits include beans, broccoli, cabbage, and Brussels sprouts. Bloating, burping, and passing gas are normal. If a baby is gassy or has colic, you might want to suggest to the mom that she avoid these foods for a couple of weeks to see whether or not they relieve the symptoms. Again, I've mentioned this earlier, but getting rid of beans, broccoli, cabbage, and Brussels sprouts, there are a lot of other foods that can fill in those nutritional gaps. So just taking out 4 or 5 foods that they may suspect is an issue isn't a big deal if they replace them with something that provides those same nutrients. So sugary drinks. So we've talked about the importance of water in terms of a lactating mom. And water is always the beverage of choice. Sugary drinks can add a lot of additional calories without adding nutritional benefits to a mom's diet. And again, we do want mom to return to her postpartum weight so that she can possibly begin a future pregnancy in the best health possible, or regain her pre-pregnancy weight as a matter of ongoing health. So some highly allergenic foods like eggs, peanuts, and nuts, some of these foods are avoided by moms because they believe that if they avoid them while they're breastfeeding, that can help their baby not become allergic to those foods in the future. But there is just no proof that exists. There's no reason for moms to avoid these foods unless she herself is allergic, or if by a trial the baby's been found to be allergic to these foods. So milk and other forms of dairy, it's rarely a problem. If the mom is lactose intolerant or has a milk allergy herself, then of course those foods can be avoided or modified in terms of a lactose intolerance. But moms should always be cautioned to just pay attention to how their baby does. If the baby has skin issues or trouble breathing or diarrhea or other GI issues, all moms should be on the lookout for those symptoms. Usually when it's recommended that a breastfeeding mom eliminate dairy products from her diet, it's because of a problem that may be caused by the protein, not because of a lactose intolerance. Remember, human milk is full of lactose. Nature is made it pretty clear that babies and toddlers can really digest lactose easily. If a mom does suspect that a baby is sensitive to a cow's milk protein in her diet, again, same thing as before. She can eliminate that food for around 21 days, again, to make sure that all traces of that cow's milk protein is gone and out of her system. And then she can see how her baby reacts to her current non-milk or non-dairy diet. Some babies do react well if dairy products are removed, like milk and yogurt, cheese, cream, ice cream, but others really don't show any improvement unless every single trace of cow's milk is eliminated. In that case, moms would really need to identify and eliminate hidden sources. But again, most moms can tolerate easily, as long as they can tolerate. Most moms can tolerate milk and dairy. And again, with spicy foods. So most babies can handle spicy food, and most babies can handle other fiery foods. But if a mom does suspect that a little one is gassy or colicky, or they have GI issues like diarrhea, then again, just cut back on those spicy foods, and mom will have to push those off into the future when she's not lactating. But again, eliminating these foods, that won't be a nutritional issue to the mom. That'll be more of a taste issue for the mom. So in the past, some parents avoided allergenic foods when there was a family history. However, most foods are considered acceptable unless they cause allergic reactions in the parent, or the mom consumes them in excessive amounts. Highly allergenic foods like milk, eggs, wheat, and peanuts do not necessarily need to be avoided unless the mother is allergic. Other nutritious options should be chosen. Generally, infants should not have those foods until after 1 year of age, along with egg whites, seafood, corn, and honey. Again, no food needs to be avoided unless there's a specific reaction like fussiness. Within a month or two, the infant's digestive system will mature and the food may be introduced, and chances are the food will be well accepted. For the mother, if she is allergic to dairy products, there is a wide variety of non-dairy calcium-rich foods. Keep in mind, there are a lot of milks on the market shelf these days, and they are not all the same. This is where reading the label and determining if it's a good source of calcium, vitamin D, or protein is important. They won't all be. Obtaining calcium is possible without taking a supplement. If a calcium supplement is used, it should be taken 2 hours separately from iron-rich foods or iron supplements, as they do compete against each other in the body. Calcium also prefers to have vitamin D around to increase absorption, which is why it's convenient to take those supplements together. Consider them kind of like food partners. Crying is one of the main ways that infants communicate, and a baby's loud wails will let parents know if they are wet, if they are hungry, if they are tired, if they are overtired, if they're uncomfortable, if they're sick, if they're the list goes on and on. Parents really do need to identify the source of the crying. And a lot of parents, as a general rule, a lot of parents do assume right off the bat that a baby is hungry. Once the need in question is taken care of, the baby should calm down. Some babies keep crying long after they've been fed or they've been changed and cared for. And instead of calming down, they kind of ramp up. They cry even more intensely. And sometimes babies pull up their legs. Sometimes they pass gas. There are a lot of different ways that colic, which is what we're talking about, that colic can exhibit itself. Colic is defined as inconsolable crying with or without gas. Over time, babies do develop their own rhythm of crying. They also develop their own rhythm of feeding, of sleeping, and of playing, and of communicating, and parents will learn to interpret the different cries. However, there are still times when they have variations in their schedule that really include moments of hard crying. Despite the universalness and frustration that accompany colic, the exact etiology of colic is unknown. Effective treatments really remain elusive. With minimal quality evidence to support interventions for colicky infants, we often, really have nothing to rely on. We look at old wives' tales or other advice, which usually isn't very helpful. This is a very exasperating condition, and it really doesn't have very many remedies. The good news about this is colic usually isn't a sign of anything serious, although it is very common, and up to 30 to 40% of infants have crying spells. The crying spells should subside within a few months. Babies who have colic, they can start crying for no obvious reason. They start crying suddenly. They often cry in the early evening, although the crying can start at any time of the day. They can cry for more than 3 hours a day, on more than 3 days a week, for more than 3 weeks. And that's where that rule of 3-3-3 comes into play. Sometimes they have a swollen belly, and they may pull up their legs to their chest and pass gas. And babies are often hard to soothe. So to recap, colic is defined as a state of fussiness or crying that lasts for more than 3 hours a day for at least 3 days a week, over a period of about 3 weeks or more. Again, it usually starts around week 3 and ends around 3 months of age. And 3 months of age is that point when babies are thought to generally be more able to self-soothe. Doctors aren't really sure what causes colic, and we mentioned that earlier, but babies who have colic may become easily overwhelmed by lights and sound and just other stimulation. They may be more sensitive to a food that their mother is eating, such as soy or dairy, if they're having trouble breastfeeding. They may be more sensitive to a food that their mother is eating, like soy or dairy, during breastfeeding. They may have trouble consoling themselves or self-soothing. And keep in mind that colic isn't an illness, although some babies do cry a lot when they're sick. Now, we really don't know which babies get colic. Any baby can get colic. It doesn't matter whether the baby is breastfed or whether they're bottle fed. About the same number do get colic, and about the same number of baby boys and baby girls get colic. Babies may be more likely to get colic if they eat too much or too little, if they eat too quickly or swallow too much air while nursing, which causes gas. They may be more likely to get colic if they have an allergy to formula or to a food in their mom's diet, if, again, they're breastfed. If they live in a stressful environment, sometimes that can make babies more prone to be colicky. If they start eating cereal too early, that can be another trigger at around 4 months of age. However, keep in mind that none of these characteristics or situations may be present, and the baby may still be colicky. In regards to maternal food intake and colic, keep in mind a few principles. The number one reason for visits to the pediatrician are crying, incessant, persistent crying, and parents often perceive incorrectly that the inconsolable crying is either a sign of a serious illness or a result of poor parenting skills. The reality is that most pediatricians will still want to see the baby. They want to rule out other issues or conditions that the baby may have. So if a mom is concerned and does want, a pediatrician to look at the baby because she feels like he's crying too much, that is completely okay. Again, we want to rule out other issues. Some recommended options to try resolving the situation with colic may be swaddling, using a snug swaddle. An infant may feel more secure when they're wrapped up snugly. Other options may be white noise. Sounds like a vacuum or other repetitive or rhythmic sounds may be soothing. Even things like radio static, a running shower, a special white noise machine, a washing machine may really help with reducing the other stimulation that a baby is feeling. Some babies may be helped out by a different position. A different position may help as well. Changing position for a baby to a new position may help calm her down. Or having a baby be given a massage by laying her, tummy down across knees, rubbing her back. Those may help as well. Or just a simple walk in the evening. Colic often occurs in the early evening, and if a mom just wants to take her baby out for a walk around the neighborhood with a stroller, sometimes that fresh air, that outside environment may really help. Unfortunately, a colicky baby may not respond at all to any calming methods. Now let's look at diet. So in terms of diet, current guidelines recommend really only one strategy for breastfeeding moms. This is the case where sometimes a low allergen diet may be recommended. And again, this may or may not work. Recent studies do suggest that low counts of intestinal lactobacilli may actually play a role in colic, and some do have documented improved symptoms after treatment with lactobacilli when compared with other treatments. More studies are needed to determine if additional lactobacilli during breastfeeding will assist with treating colic. And this is where we are going to wave the flag on caffeine, because caffeine may in fact play a role. A cup of coffee or other containing beverage, usually that's okay, but some babies are simply more sensitive than others, and they may experience that jitteriness. Certain caffeine-containing beverages these days are super high in caffeine. Even certain coffee brands are marketed due to their high caffeine content, and one shot of espresso that can really sometimes push a baby over the edge. Now, reducing caffeine may or may not make a difference, but it is worth trying. Now, just circling back around to allergenic foods and the role of colic, although there is little evidence to support the avoidance of certain foods during lactation, again, unless the mom is allergic, like with cow's milk or wheat, nuts, or other common allergens, some mothers do report specific foods causing their infant distress. Acknowledging the information and supporting the mom is key. And unless there's a significant avoidance of a food group, eliminating certain specific nutrients here and there is generally not going to be detrimental to the health of the mom. If she avoids Brussels sprouts, well, there are a lot of other foods that can fill that nutritional gap. Onions she's avoiding, okay, again, that's not going to cause her to be deficient in a certain nutrient. Mom should also be cautioned that, this may or may not be a factor in future babies. All babies are different, and, some babies are sensitive to certain foods and others aren't. So just because in her lactation experience with one baby, she finds, a certain food might trigger a response, it doesn't mean that subsequent lactation experiences are going to be the same. One final note about dairy, that if a mom is looking to remove dairy, this would be the elimination of an entire food group. And, eliminating milk and cheese and yogurt and cottage cheese, there are other ways to obtain calcium and protein. But if they're looking at eliminating dairy completely, this is again where label reading is critical. Dairy can hide out in many products. There's pizza, cheese crackers, creamy salad dressings, cheesy salad dressings, smoothies. Even, remember we talked about casein and whey, which are the proteins in dairy. Those may appear in certain foods. And so positive results have been observed when mothers who recognize that dairy may be an issue with infants who test positively for a skin test for milk allergy. When moms realize that the dairy is kind of the culprit there, she really does need to examine food labels carefully in order to identify, those really stealth dairy products. Out there about colic, there are a lot of home remedies that people try that are supposed to relieve colic and they don't. Most aren't proven, and some of them could actually hurt the baby. And again, the pediatrician should always, just be consulted to rule out other issues, but never should moms try, these following things like rice in a bottle. That's a huge no-no. It's a big choking hazard. It can destroy satiety cues. It can lead to an overweight baby, and it just isn't proven to work. Other herbal remedies like chamomile or what's called gripe water, the FDA doesn't regulate over-the-counter remedies. We're really not sure what is in a lot of different herbal preparations, and ingredients aren't always labeled. Some of these can have things in them that are definitely harmful, like alcohol or even opiates. So simethicone gas drops, well, these might be okay to try. Not sure if they'll work. They have been seen to work in some babies, but not in all. Again, they may or may not help, but again, just checking in with the doctor, verify that this is something that the mom would want to try would be a good idea. This is the end of part 3, nutrition during lactation.